Russ, you're one of the people that pioneered the notion of support groups for bipolar students in a university population. You know that when we did our training, that was unheard of. And it's something you started here that's been enormously successful. And talk about that if you would.
Yeah, glad to. Because you're right, we've seen enormous success with it. Let's talk first about what we typically did see with bipolar treatment, and that is most students who came to a counseling center were referred out into the community because bipolar was seen as a chronic, longer-term disorder, and most counseling centers these days do brief treatment, all right? So they go out into the community and they see a psychiatrist maybe once a month, maybe once every 6 weeks. If they're doing well on their meds, it might even be once every couple of months, right? And the psychiatrist or whoever their provider is doesn't see them with a high level of frequency, and a lot can happen in between 6 weeks or 2 months' time, right? The other thing we have to recognize is that the bipolar student at a university is in a very, very small percentage group. In the full population, bipolar disorder represents about 2.5%. At an elite university, it may represent 0.5% or even 0.3%. So for a bipolar student to turn to a friend and say, you know, I got bipolar, the friend generally is not going to understand what they're talking about. They're not going to have bipolar. And the amount of students that the individual is going to be able to easily connect with just in the general population that have bipolar disorder are very small. Now, I find that when you bring the bipolar students together and they can meet once a week in a supportive environment and talk about their experience with the disorder, they feel a tremendous sense of connection with the other students. They feel like the issues they struggle with suddenly are normalized because they're not so different than the other individuals in the group. They hear some of this, or they observe some of the same struggles in their group members, and they go, you know, it's not just me, it's others who have this disorder. And so maybe I'm not so different than others who have the disorder. They come to learn from other members what has helped them. And so let's say you have a graduate student who's been living with his or her disorder for numerous years, and you have a second-year student who's just received the diagnosis 2 months ago. This graduate student is a wonderful source of learning and information for the younger student. It's a place where they feel tremendously destigmatized and understood. They can say, you know, last week I was crazy. I was just feeling up and all over the place. And they don't have to say much before the other students are nodding in agreement and getting what they're saying. They're readily understood and accurately perceived. And that same student, in relation to the general population, doesn't get that. So I find that when you see students frequently in a support group, and it's important that it be led by a professional who knows a fair amount about the disorder, when you see them in a support group frequently, you can stay on top of their progression, and if they destabilize, you might even be able to spot it before they do. In fact, the other group members will spot it before they do. And so it's a way of them kind of getting alerted to the fact that they may need to make some adjustments. And there's a tremendous sense of relief and connection that these students begin to feel that they hadn't previously felt. I find that their treatment compliance increases, and the frequency of their periods of destabilization decreases, largely as a function of this regular support group meeting. If students out there are watching this video and they're at a university, I really encourage them to go to their counseling center director and speak with him or her and say, do you have a support group? And if not, what can we do to create one? Because it will be tremendous benefit to them.
And I want to go back to two things. The percentages, because if it's 1% at a university of 20,000 students, that's still 200 students with bipolar disorder.
Right.
And even if it's really low, let's say 0.5%, that's still 100 students.
Correct.
And I think it's actually a little higher. I mean, I think it's closer to 1 to 2%. So we're talking about several hundred students. And so you're not going to be alone. So as you said, anybody that's listening to this, if you're at a university of any number, there's going to be, you know, if you're at a university of 10,000, there's going to be 100 of you there. And I think want to get that support group going for the second reason, which is you're going to do better in school. I mean, you and I trained in a time when students with bipolar disorder, a lot of them didn't graduate. And I think one of the things we've seen with the support group here is we're having students graduate who might not have otherwise. We're having students graduate on time. I think it's really important to highlight that.
Absolutely, I agree.